Hello and welcome to this video lecture series on the musculoskeletal system, which covers chapter 38. We are going to cover section 1 in this video, which discusses the types of skeletal systems. Our learning objectives are to discuss the different types of skeletal systems, explain the role of the human skeletal system, and compare and contrast the different skeletal systems. First, we'll discuss the hydrostatic skeleton, which is a skeleton formed by fluid-filled compartments within the body known as the coelom. And the coelom organs supported by aqueous fluid, which resists external compression. It has mobility due to muscles being present here and can change its shape. And the compartment is under hydrostatic pressure because of fluid, and it supports other organs. We usually find this in animals that are soft-bodied, such as anemones, earthworms, cnidaria, and other invertebrates. Next up, we have our exoskeleton, which is an external skeleton. It is a hard encasement on the surface of our organism, and so we can find it in animals like crabs and insects, and they are going to have the skeleton provide a defense against predators, and it will support the body and allow for movement through the contraction of attached muscles. These muscles, though, have to cross a joint and can be strengthened by the addition of calcium carbonate. These can be acellular, and so the arthropods must periodically shed their exoskeletons because it doesn't grow as the organism grows. And then we have our endoskeleton, which is a skeleton that consists of hard mineralized structures located within the soft tissues of the organism. Primitive examples would be the spicules of sponges, and we have the bones of vertebrates that are composed of tissues. This is what we have as humans, and it provides support for our body. It protects our internal organs, such as the heart or the lungs or the brain, our spinal cord, and will allow for movement through contraction of muscles attached to our skeleton. So let's dive in a little bit deeper to the functions of human skeleton. We have that it supports our body. Without it, we would be just a puddle of organs and muscles in the floor here. And then we are going to work within our muscular system to move the body, and we have protection as we described in the previous slide. So the skull is protecting our brain, the rib cage protects our heart and lungs, and our vertebrae protects our spinal cord. And within our bones, we are able to produce blood cells. And so here's a picture of homeopoiesis where we can see our stem cell giving rise to all the different blood cells that we have. And this takes place in the red bone marrow. And we are able to store minerals such as calcium and phosphate within our bones and fat within the yellow bone marrow. So we'll first really discuss the bones of the axial skeleton in detail. We have 206 bones of the skeleton, and we classify them as axial or appendicular. So axial skeleton is what we see here in the center of the body, the midline of the body. And it consists of our skull, the ossicles of the middle ear, which we don't see here because they are super, super small. And then we have our hyoid bone right under our chin. If you slid your hand back, you would run into that hyoid bone. And then we have our vertebral column down the center here and the rib cage. So all of that belongs to our axial skeleton, and the function of it is to provide support and protection for our brain, spinal cord, and other organs in our ventral body cavity. It'll also provide as a surface for attachment of muscles to move our head, neck, and our trunk, and performs respiratory movements. We would have that diaphragm attaching down over here, and then we also have our intercostal muscles, which costal means rib, so and we know inter means between. So the muscles between the ribs here will help us to lift the thoracic cage and then depress the thoracic cage, along with some other accessory muscles that we'll get into in the respiratory system. And we are going to help to stabilize the rest of our skeleton, which is classified as our appendicular skeleton, because these are our appendages here in the white and gray. We'll start going through the bones of the axial skeleton from the top down. So the skull here is formed by the cranium and facial bones. The cranium, which are going to be these bones up here, will contain and protect the brain. In an adult, it's made up of 8 bones, but in newborns, as you could see pictured over here, it is going to be made up of more bones because our cranial bones are going to be joined by these fontanelles. And these are just soft spots where we have membranous connective tissue, and they usually close by the age of 16 months. So we can see here the anterior fontanelle is going to help close up this area of the frontal bone and our parietal bones. And we also have this posterior fontanelle that will be the site where we see the joining occipital bone with our parietal bones. So let's take a look at what our adult bones look like. So here we see our frontal bone, parietal bone, occipital bone, temporal bone, the sphenoid bone, which we see a small sliver of here, and our ethmoid bone closer to the orbit of the eye. And we also have some other portions in the nasal cavity, which we don't have the best view of here, but we'll take a look at some other photos. So I want to highlight some of the major bony landmarks that we have in the skull. And first up is the foramen magnum. So again, here is our occipital bone, and within that bone we're going to see this large hole. Foramen is a Latin word that we use for hole, and magnum sounds like it is large, right? Which it is. And so this is where our spinal cord is going to transmit or move through the giant hole here, the foramen magnum. The next structure we have is the external auditory canal, and this could be found on the temporal bone. It is a, as it states, a canal. So you'll see a hole, and it'll be a tube-like structure that will lead from the external ear over to the middle ear. And then we have our sphenoid bone, which again, we only see a small portion of here, and you also see it in the purple in this inferior view of the skull here. And this helps to complete the sides of the skull and contributes to forming the orbits or our eye sockets. And then we have our ethmoid bone. So again, we just see a small portion of it here. This is going to help to form the orbits and the nasal septum. Let's talk about the auditory ossicles, or the small bones of the ear. We find this in the middle ear. So if we are looking from the outside of our head here where we see the ear, this opening here would serve as our external auditory canal, and it leads to the middle ear, like we said. So the very end here of our external auditory canal, we find the tympanic membrane, or what most of you know as the eardrum. And that eardrum is going to attach to these 3 small bones. We have in red the malleus, then the incus, and the stapes. And so as the sound waves comes through this canal, it causes the tympanic membrane to vibrate, which causes vibrations to shift through these small bones and pushes against the oval window here, which shifts the fluid in our cochlea, which is found in the inner ear. And these small bones are unique to mammals. Let's take a look at some of the bones of the face. When we look at somebody's face, we see on their forehead their frontal bone, their temples are made up of the temporal bone, and their bridge of their nose is made up of the nasal bone. As we shift down, we see that their cheekbones are made up of the zygomatic bone, and that will connect back to the temporal bone. And then we have our upper jaw as the maxilla, and their lower jaw is made up of the mandible. And within our bones, at least in the skull, we have these air-filled spaces known as sinuses. They're going to be lined with a mucous membrane, and they're there because they reduce the weight of our skull and can help to give resonation to the sound of our voice. We've got 4 total. We have the frontal bone. So if you ever feel tenderness in the space between your eyebrows here, it may be your frontal sinus here within the frontal bone. Then we've got your sphenoid sinus, which we could see in this lateral view. And then we have our ethmoid sinuses. These are sometimes called ethmoidal air cells, and we could find them around the nasal and orbital area. And lastly, the largest one is going to be the maxillary sinus, which we find in relation to the maxilla bone, and we can find it above the teeth. So sometimes when we have a sinus infection here, we can have pain within the teeth. We also have some smaller sets of sinuses known as the mastoid sinus, and this drains into the middle ear. Sometimes when we have inflammation in the sinus, it is going to cause mastoiditis. Now let's talk about some of these bones individually. First up is our mandible. This is our only movable bone in the skull. We have a joint back here called the TMJ, temporomandibular joint. Then we have our maxilla here that are going to form the upper jaw and portions of the orbit. So notice how this bone kind of creeps and creates that, what we would call the medial, meaning closer toward the midline, inferior, meaning further down, portion of the orbit or the eye socket. Then we have our hard palate, which we need to turn to this inferior view in order to visualize. And this hard palate is made up of the maxilla as far as the anterior 2/3 of the hard palate. And the posterior 1/3 is made up of the palatine bone pictured in green here. And then we have our zygomatic bone, which we saw in a few slides ago, makes up your cheeks. And this is a nice internal view of the nasal cavity. So this is a slice through the skull in a sagittal view. I know it says mid-sagittal, but then we would be going right through the septum. It really should be sagittal because we're just a little bit lateral to it in order for you to see this septum. So let's start here. Our nasal bones are going to form that bridge of the nose. And then to create the nasal septum, we have the ethmoid bone here in purple, and then this other bone called the vomer. The vomer was named so because it means to vomit and was shaped like a plow that they would use to vomit up the earth. And then anteriorly, or toward the front, we see this cartilage here, and we just call this septal cartilage. We also can see the nasal septum in this illustration over here. This line down the center would be the nasal septum. So just to give you a little bit of perspective what we're looking at, we have sliced the skull in the coronal section or coronal plane or frontal plane, where we are dividing the anterior side from the posterior side. So here we are seeing the orbit or the eye, and down here is the nasal septum, and here we see the maxillary sinuses. Now, in order to see our lacrimal bone, we need to take a look at a lateral view here, and we look in the area of the orbit. The word lacrimal means tear, so anatomists thought this medial side of the eye is where our tears come from. But in actuality, the tears are created in a structure up here called the lacrimal gland, and then they wash over the eye and then come out the medial side. Here, there's an opening called the nasolacrimal canal, which is going to drain the tears from our eyes into our nose. And you could see this nicely illustrated in this illustration here, where we have our lacrimal gland creating the tears. They move through these excretory ducts, wash over the eye, and then will move into these little canals that take it into the lacrimal sac, and down the nasolacrimal duct and into the nose. This is why we sniff when we cry and have an excess amount of tears. Next up, we have our hyoid bone, which is such an interesting bone because it's not a part of the skull, but it is a part of our axial skeleton, and it does not attach to any other bone within the body. It's actually suspended by 22 muscles and ligaments. And so our hyoid bone is there because it anchors our tongue. And you could see this well illustrated down over here. And it's serving as a site for attachment of muscles associated with swallowing. Now into our vertebral column, which is going to consist of 33 vertebrae. There are 4 curvatures that we have of our vertebral column that'll provide more strength for an upright posture than a straight column. Sometimes we have different exaggerated curves of the spine, which could cause scoliosis if it is more of a lateral type of curvature, typically within the thoracic vertebrae. We could have kyphosis when we have an abnormal posterior curvature of our upper thoracic vertebrae, which is known as hunchback. And then we have lordosis, where we have an abnormal anterior curvature of the lumbar vertebrae. And this is also known as swayback. Here's an interesting case where a 15-year-old boy has 3 extra vertebrae in his neck. This is a condition known as supernumerary vertebrae with congenital scoliosis. It unfortunately causes pain and stress on his nerves, and it makes it difficult for him to walk. And with these vertebrae being stacked on one another, it creates a vertebral canal. And in the center of it, we will have the spinal cord passing through. So this really nicely illustrates here that vertebral canal. And in this image down here, we could see the spinal cord passing through, and at each level, these spinal nerves moving out through this hole known as intervertebral foramina. Foramina is just the plural of foramen, meaning that we have many holes here. And these spinal nerves are important because they're going to control our skeletal muscle contraction, amongst other things. And if our spinal cord or the spinal nerves are injured, then it can cause paralysis or even death. And here's a view of the vertebral column again. We can see at the very top here, oh, my mouse is disappearing, so I don't know that I can point to this properly. Okay, now I can see it. So at the top portion here, we have our cervical vertebrae. We've got 7 of them. Then we have our 12 thoracic vertebrae and our 5 lumbar vertebrae, our sacrum, and lastly, our coccyx. So we'll talk about those individually in a more advanced class, but I also wanted you to be attuned to the different curvatures of the spine. I lost my mouse again for some reason. I know you could see it, but I can't see it. So anyway, look at the image on the right-hand side here. And at the top where we see cervical curve, notice how we have that convex anterior portion of the cervical vertebrae. So just want to illustrate this for you to understand how these curvatures develop. When we are a fetus, our spinal cord is actually a C like this, so we call this a primary curvature. As we start to crawl, we are going to pick our head up and look up in front of us, and so we start to see the cervical vertebrae, and I'm exaggerating this, right, is going to form this secondary curvature. That thoracic curve will stay with the primary curvature, and then our lumbar vertebrae, as we start to stand up and walk, will start to create a secondary curvature. And then our sacrum and coccyx will keep that primary curvature. So again, this is very exaggerated, but fits the same curvature as we see here in an adult. So let's talk about some of the major features of our vertebral column. First is going to be our spinous processes, which is probably what you feel if you run your hand down the midline of your back. And so these are just bony projections down that midline. Our transverse processes are going to be extensions that move out laterally, and in the thoracic area, we are going to have the ribs articulate here. And these, both the spinous processes and transverse processes, serve as attachment sites for muscles. Sitting in between the vertebral bones is going to be our intervertebral discs. This is composed of fibrocartilage, and they prevent the vertebrae from grinding upon one another. We have absorption of shock caused by movements such as running, jumping, and even walking, and it allows our vertebrae to move as we bend forward, backward, and side to side. And when these intervertebral discs become weakened with age, they can herniate and rupture. And the pain is going to result if that disc is pressing against the spinal cord or the spinal nerve. So in the center, we have our nucleus pulposus, and that could be under so much pressure that it pushes out past the disc annulus, also known as annulus fibrosus, that pushes against that nerve root. Now let's move into the rib cage, also known as our thoracic cage. It's going to be composed of our thoracic vertebrae posteriorly, and then our ribs wrap around from the posterior side laterally, and then will in some form attach to the sternum. This is going to be a part of our axial skeleton. It'll protect our heart and lungs, and like I said, it swings outward and upward upon inspiration. So using those intercostal muscles for help to lift those ribs up during that inspiration or inhalation. And then we'll use other intercostal muscles to push downward when we expire or exhale. And we have 12 pairs of ribs, so 12 on each side, that are going to connect directly to the thoracic vertebrae in the back. Each of these ribs will articulate with the body and the transverse process of the thoracic vertebrae, and then they'll curve outward and then forward, and you can see that they're moving a bit downward. We do classify these ribs, so ribs 1 through 7 are known as our true ribs, and they're classified based on if they truly are connecting directly to the sternum. We have costal cartilage here that is going to connect that anterior end of the rib to the sternum. Remember, the word costal means rib. And then we have our false ribs, which are ribs 8 through 12. So notice that's all of them in the green and the blue here. And their costal cartilage does not connect directly to the sternum. So notice that the false ones here, so we've got 8, 9, and 10 that are going to have a costal cartilage, and actually this one should also be jumping on over here, has costal cartilage that is jumping onto the one above it in order to attach to the sternum. So it's a bit of an indirect manner. And then we have our floating ribs here, ribs number 11 and 12, that are just going to have a little bit of hyaline cartilage at the very end. So they have no connection to the sternum. So let's talk about the sternum itself. This is known as our breastbone, and we could see that the costal cartilages and the ribs are going to work with the sternum in order to protect our heart and lungs. We have 3 different parts of the sternum. We have our manubrium, which is going to be what we call the handle of the sword. They kind of named this looking like a sword here. And this manubrium is articulating with the clavicle. So we don't see the clavicle pictured here, but it would attach right up in here. And we'll see that the manubrium is going to join the body of the sternum. This is like the main mass of our sternum. And at the very end, we have our xiphoid process, which is the tip of our sternum. We also have this area called the angle, and that's where this manubrium and the body of the sternum attach to one another or articulate. And this is a very important landmark because we can palpate this, and that helps us to find rib number 2, which essentially is the area where we would find the apex of the lung. And counting ribs is sometimes done to determine where the apex of the heart is located, which is usually between the 5th and 6th ribs. Our xiphoid process is going to serve as an attachment site for our diaphragm, which would be right along in this area. And the diaphragm helps to separate our thoracic cavity from our abdominal cavity. Now let's move into our appendicular skeleton. Like we mentioned before, this is composed of our upper limbs and our lower limbs. It'll include what we call the pectoral or shoulder girdle, and that it will attach our upper limb bones and obviously attaches our upper body to the axial skeleton. And then we have our pelvic girdle that is attaching our lower limbs to the body. We'll start off with our pectoral girdle. Our pectoral girdle is going to consist of the scapula, which is our shoulder blade, and our clavicle, which is known as the collarbone. Notice how we are not including the humerus here. It's only these two structures that make up the pectoral girdle. And on our clavicle, we will see that we have an end, which is pictured right over here. Trying to see which picture I can use. And this acromion process will attach to what we call the acromial process here on the scapula. So that's a little confusing because they have the same name, but on the clavicle we call this the acromial end, and on the scapula we call it the acromion process. So acro means the highest point, and anatomists looked and said this seems to be the highest point in the shoulder, so they named it acromion. Then we have our coracoid process, which is this structure right in here. I'll point it out in this image here as well. And the word coracoid means crow's beak. So it's an outgrowth of bone that looks like a crow's beak. And so they called it coracoid process. That word process just means an outgrowth of bone. And we're going to have a lot of muscles in our arm and chest attach here. Lastly, on the slide, we have the glenoid cavity, which is this depression right in here, and it's going to articulate or join the head of the humerus or our arm bone, and that helps to create our shoulder joint. This joint is going to be very mobile, and so the more mobility we have in a joint, it means the more unstable it is. So it can dislocate, which you can see pictured over here. To help prevent this dislocation from happening, we have tendons and ligaments that help to stabilize it. And we call this our rotator cuff, where we see tendons that are extending to the humerus from our small muscles that all originate from the scapula. So we have vigorous circular movements of our arm that can lead to this rotator cuff type of injury. Now let's move further down the upper limb. We have our humerus, which I mentioned is our arm bone. And in the forearm, we will have our ulna and our radius. Our humerus is going to be a single long bone in the arm. It has this smooth rounded head that's going to fit into that glenoid cavity of our scapula. The long portion in here is going to be called the shaft of the humerus, and it has a tuberosity. That word tuberosity is a roughened bump, and sometimes it is called a protuberance. But this area has that roughened bump so that the muscle known as the deltoid muscle can go and insert and attach to the bone there. The far end of our humerus is going to have two protuberances, which we call the capitulum and the trochlea. These are going to articulate with the radius and the ulna. So here we see the humerus just on its own, and down here we see the radius and the ulna attaching in order to make the elbow joint. So the head of the radius is going to rotate around the capitulum, and the ulna is going to rotate around the trochlea. If we look at the posterior or the back area of the humerus, we see a depression here, and this is known as the olecranon fossa. We have a structure on the ulna known as the olecranon process that is going to articulate or attach to the fossa. so that it can move in and out of this area while our elbow flexes and extends when we bend and straighten the arrow, essentially. And I forgot to mention that the word trochlea was named after a spool of thread. So that's the shape that it has here. And I always like to think of the olecranon of a little leprechaun just sitting in your elbow to help you remember the name olecranon. Let's move into the hand. We have our carpal bones right over here, and these are the 8 bones within our wrist. Beyond that, we have our metacarpal bones, which are the 5 bones in our palm. And I really like this here so we can see the illustration of where these bones are going to lie. And let me see if I can play this video. Whoop. That doesn't seem to be working. Let me try. Nope, not working. Okay, well, we gave it a shot. And so, where did we leave off? Our metacarpals are going to be in the palm, and the metacarpal that leads to the thumb is opposable to the fingers, meaning that we can reach this thumb over and touch each one of the fingers. And I just put this fun clip of the show Friends where Phoebe, for some reason, always uses the fake last name of phalange. That's referring to the phalanges, which make up our fingers here. So this head of the metacarpal is going to create our knuckles, and beyond that we will see that we can bend our fingers, and before each bend, I should say, we have a phalange. So our proximal phalange, our middle phalange, and our distal phalange. Notice how the thumb only has 2 of them here. I'm a big lover of Friends, so here we have Ross and Rachel, and my husband and I actually dressed up as them for Halloween just this past year. All right, let's move into the pelvic girdle. And now let's discuss the pelvic girdle. This is also known as the hip girdle and consists of 2 coxal bones, meaning our hip bones. Our pelvis is composed of this pelvic girdle and the sacrum and the coccyx. And this bears the weight of our body and protects our organs within the pelvic cavity and is the place of attachment for the legs. We can also see how the pelvis size is going to differ when we look at someone who is born as a biological female versus a biological male. Each of our coxal bones are made up of 3 separate bones. We have the ilium, the ischium, and the pubis, which are all going to be fused in an adult. And where they come together, we have a acetabulum. I'll point that out on another slide in a lateral view so you can see this a bit better as well. But this is where you're going to have the head of the femur articulate to create the hip bone. And our ilium is going to be the largest. The ischium is going to be what we sit on. Sometimes when you do yoga, they always say we're going to pull back and sit on our sits bone, and that is this part right back in here. We also have a special feature called the ischial spine, which you will see better illustrated on another slide. It's kind of hidden back in here, and this is a place where we have muscle attachment. Our 2 pubic bones, which you see in yellow, are joined together by a fibrocartilaginous joint called the pubic symphysis, or sometimes the pubic disc. And I put in this hello obturator so that you can remember this opening here called the obturator foramen. And it does kind of look like an old school telephone. And as I mentioned, the male and female pelvis are going to differ. So here you are going to see that the male pelvis is going to be more narrow. The female pelvis is wider, and that's partly because the iliac bones are more flared, whereas here in the male they are more shallow. We have these different adaptations because they are going to facilitate the birthing process in a female. So I always like to remember this as, if you remember in elementary school, you would fold your piece of paper as either a hot dog or a hamburger. And the male is more narrow and taller, and therefore I think of it as a hot dog, and the female is shorter and wider, and therefore I think of it as the hamburger. Now moving further into the lower limb, we've got our femur, and we find this bone in our thigh. Below that, we'll talk about our leg, which has our tibia and our fibula. The femur is going to be our longest and strongest bone in the body, and the head here you can see is what I discussed articulating with the acetabulum. You could see that it then narrows and becomes the neck, which is going to better position it for walking. Our femur will also have two large processes on it. We have the greater trochanter, which is more lateral, and the lesser trochanter, that's more medial, and we have muscles that will attach here that are from the thigh, the buttock region, and our hip flexors. At the distal end, which is what's pictured here, and distal we mean closer to the knee, the femur is going to have both lateral and medial condyles that are going to articulate with the tibia. If we look at the knee area, we have a bone called the patella, which we know as the kneecap. That's held in place by the quadriceps tendon, and it'll be continuous within this ligament here called the patellar tendon. Above it, we find the quadriceps femoris muscle tendon that encases the patellar tendon, and then this patellar tendon is going to go down and attach to the tibial tuberosity. Now when we look down on the knee, or past the knee rather, and down to the distal end of the leg, we will see some of the features of the fibula. The fibula is going to be that lateral slender bone in our leg. Now the head is articulating here by the tibia, but down at this distal end that I was mentioning is where we're going to find the lateral malleolus. That is that bump that we call our ankle on our leg. And it'll form the ankle along with what we know as the medial malleolus with the tibia. And here, if we look in the foot, we have our tarsal bones. These are the 7 bones in the ankle. We have the talus, which I remember that as being the tallest, and it's going to join our tibia and our fibula in order to create the ankle joint. Now below, and you could see the larger mass of this below the tibia, we have the calcaneus, and both the talus and calcaneus are going to support the body weight. Beyond this, we will have our metatarsals, which are the 5 bones in the instep, and lastly, the phalanges, which have a similar distribution as we saw in the hand.